Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit systems of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm Jenny Sutherland, your host, and I'm sitting here in disbelief that the holiday seasons are upon us. But we're not here to talk about the holidays for this show. We're talking about another season, and it's the season of the flu. So our expert on the influenza virus is Susan Tolles, RN, BSN, Quality Manager for Berkshire Healthcare Systems. Welcome, Susan.
Thank you for having me.
Well, it's a delight to have you here, professionally and personally. I just admire your work with the quality team to help Berkshire achieve all that we do for our communities. Before we talk about the flu, can you share with us a little bit about your role for Berkshire?
Sure, I'd be glad to. I'm a quality improvement manager, and I support the 6 Berkshire healthcare facilities. And what I do is ensure that we're in compliance with regulatory issues, not only in compliance, but we exceed the expectations. Okay. And I also provide consultation on quality issues in healthcare to the directors of nursing and the nursing teams at the facilities.
Well, and I need to let you know you're a very valued support system to the affiliates you work with. You're one of the most beloved people in our organization, so thank you on behalf of all of them. And I think that you know something about the flu. Is that true?
I do.
Please share about the flu and you.
Well, every fall, the flu virus begins to circulate, and it circulates through the winter months and oftentimes into the spring. So influenza is a virus. Antibiotics will not get rid of it. And the only way to avoid getting the flu is to get the flu vaccine.
Okay. So a lot of times people will say, I don't feel good, I have the flu. Or they'll say, you know, I just have a cold, and clearly we can tell it's something more. So can you share with us the symptoms of the true flu virus?
The symptoms of the flu generally begin with a sore throat, okay. And then fever, coughing, nasal discharge, and very severe aches, pains, fatigue. Joint aches that are beyond anything that is normal.
Yeah, and that's one of those things I've heard you ask people, are you achy? And some people say, oh, I feel like a truck ran over me and stuff like that.
That's exactly what it feels like.
And, you know, I don't want to, go to a disgusting area that will make me uncomfortable talking about, but the stomach virus is more of a...
Generally, stomach viruses are not influenza. Okay. Sometimes children have stomach symptoms associated with influenza, okay. But not normally adults.
So the stomach flu is kind of not really.
Completely different thing.
It's a whole different thing, okay. All right, so and a cold isn't as severe as a cold as a cold.
And minor in
yes.
comparison to influenza.
All right. And I know I asked you this, but I'm going to ask you again because somebody in the audience might want to know this. I know I did. Do you feed a cold or starve a fever? Is it feed a fever, starve a cold?
I personally feed them both.
And that's why I respect you so much, because I'm always about feeding whatever's going on.
That's right.
And I know when people have the true flu, they don't really want to eat.
No.
And that's one of the symptoms.
The reason for that is that the fatigue that accompanies the flu is so intense that you barely can lift your arm. So influenza is very different from the simple common cold.
Yeah. And I have to say, I had it once, and I believe someone was on the phone with you talking about it, and you asked, was I eating? And they said no, and you said, well, that's that then. She's got the flu. Because I'm always
confirmed.
good for it. It's confirmed. There's a problem. And so I want to go to something that you're very passionate about and believe very firmly in, and that's getting the flu shot.
That's correct.
All right.
So the flu vaccine is recommended for everyone over 6 months of age.
All right.
So there are some variations on the flu vaccine for people under 49 years old. They can get a nasal spray vaccine. Some people are fearful of shots, and so they opt for the nasal spray. The nasal spray is a live virus vaccination
Versus the shot.
versus the influenza vaccine. The shot is a killed virus, so it is impossible to get the flu from the flu shot.
And we're going to say right here, and you've heard this from a lot of people, I don't want to get the shot this year because I got the shot last year and I got the flu. And you told me, and I believe you, what?
Well, the flu viruses that are included in the vaccine change year after year. That's why you get a flu vaccine every year.
Because it's going to different viruses.
Exactly.
Okay.
And so there are generally 2 influenza A viruses and 1 influenza B virus in the vaccine. So the vaccine is only going to cover you against those viruses.
Which could change year to year.
Exactly.
So
and so you could get the flu because the virus strain that you got wasn't included in the vaccine.
And I thought it was interesting when we were talking before how you said another reason people will say, oh, I got the flu from the flu shot was because they already were sick and they didn't know it.
That's right. Unfortunately, with influenza, you can have influenza for up to 48 hours before you have any symptoms whatsoever. So you can be passing influenza virus along to other folks that you come in contact with without even knowing that you're sick yet.
And I think that's a real bummer because in our line of work, we don't work when we're sick because we don't want to spread it to each other, the worker staff, but we certainly don't want to give it to people we care for. But sometimes you just don't know.
Exactly.
And that's being mindful of who you've been around, your family and friends. But sometimes you can't help it because
and that's
it's
why
out
it's
there.
so important to be vaccinated.
Okay. Some myths about the flu besides some of the stuff I asked you about, the stomach and...
Well, I think the biggest thing is that people say they got the shot and then they got sick.
So
from
that's
the
the number
shot.
one.
You know, some people are afraid of needles.
Yeah.
It's 5 seconds it takes to get the vaccine. It's no worse than a mosquito bite.
It really is, and I just got mine last week, and they said, don't look, and they were talking to me, and I'm very easily distracted, and I'm like, we're done? And that was it. And I think a lot of that is people hyping up about it, or a bad experience, and things have changed, and one of the things I've learned is needle sizes are different, so maybe in the past you had a bigger needle, but this is a pretty small one. It's not the biggest thing in the world. So that's a myth. The shot's gonna be painful and you're gonna cry.
Absolutely. And then some people will say that they're allergic to it. To avoid getting the vaccine.
I say I'm allergic to peas because I don't like to eat them.
Exactly.
I don't think I am. I hope my mom's not watching.
But people that have egg allergies can have a concern with the flu vaccine because the vaccine is made in eggs.
Okay. And but there would be a nasal spray, the other alternative for those folks.
Correct. There are other alternatives.
Okay.
And it depends on the severity of your allergy. So if you do have an allergy, it's wise to go to your own primary care physician versus going to a clinic. so that someone who knows you well
Yep.
can review your own personal history and make the best decision for you.
And I think that's a great suggestion, because I see signs all over the place. Just like I was saying, it's the holiday season. I see all this stuff. I see it's flu season because we have flu shots here. So go to your primary if you're concerned that you might have an allergy.
Right.
So that's a good
Or if
one.
it's the first time being vaccinated.
Oh,
just
yeah,
to
because
be
you don't
on
know
the
what's
safe
going to
side.
happen. Yeah.
But otherwise, their flu shots are available at every grocery store and their pharmacy. Pharmacists can provide an influenza vaccine as well as nurses. So it's just really important that people protect themselves.
Okay. So the shot we've gone over, and again, we both want to encourage people to get the shot or the nasal spray. Other ways to prevent spreading it, tips?
One of the most important things in preventing the spread of any kind of infection is washing your hands. Now, one doesn't have to obsessively wash their hands.
That's another show. Obsessive hand washing will be February 2016 show.
But it is important that you keep your hands away from your nose and your mouth.
Okay, so you're not touching.
And oftentimes people touch their face without even realizing that they're doing it. And so I tell people that have the propensity to do that, if during cold and flu season, just put your hands underneath you so that will keep you from putting them up to your face.
That's good advice for people who are hosting a TV show and you don't want to be rubbing your nose. So now I'm sitting on my hands.
There you go.
Wash your hands. Try not
Wash
to
your
touch
hands.
your mouth and your nose.
And the thing about hand washing, Jenny, is it is not the hot water that you use or the amount of soap that you use or whether that soap is plain soap or antibacterial soap. It's the friction.
Okay.
And the amount of time you wash your hands for. So you want to wash your hands
And create
providing
friction.
good friction for about 15 to 20 seconds.
Gotcha.
So
I love that you
clean
teach me
hands
stuff.
save lives.
You've said that many times before, haven't you?
I have.
And one of the things that I know that you say a lot is your little flu rhyme. You want to say it? Come on.
Open the window in influenza.
And I credited that to you for years. When people said, "What's your show going to be on?" I said, "Open up the window and influenza." And they're like, "Oh, Susan Tolles is coming on," because you say it. But that's actually a nursery rhyme.
It is. And it goes way back to 1918 when a very serious Spanish influenza swept the entire world, and millions of people died as a result of that influenza outbreak that year.
Yeah, it's a staggering amount of people, and for something that we can somewhat control now, and to think if that happened now. So again, we want to encourage people to get a flu shot, to stay home when they're sick.
Absolutely.
To be mindful of that.
And to be mindful of the fact that, as I said, influenza generally starts with a sore throat. And then when you have a fever, that's when the virus is replicating.
Okay.
And you're the most contagious.
All right, so, and honestly, sometimes when we have people helping take care of us, that's when we have them around the most. So they have to be, our caretakers, givers have to be mindful to watch themselves and wash hands then. All right. Well, that's a very good tip, and I'm glad we covered that one. Your work with Berkshire, you work with a great affiliate down in Great Barrington, because it's great, and you want to talk about Fairview Commons for a second and what they did last year, because what they're doing this year you won't be able to verify till March, I believe?
That's right.
All right, so tell us about Fairview Commons.
Last year, Berkshire Healthcare Systems is participating in a national initiative called Healthy People 2020. And one of the things that's included in that is vaccine preventable diseases and illnesses, which influenza is one of. And our employees are all offered influenza vaccine at a time that's easily accessible to them, free of charge. And last year, Fairview Commons had a 100% employee immunization rate.
That's fantastic.
It was fabulous. And, you know, it just goes to show that those employees want to protect themselves, their families, and the community they serve.
Yeah. Again, hats off to them. Hats off for everything that you do. Thank you for being here. We're going to actually watch a clip about what else is going at Fairview Commons. So we're going to say goodbye to Susan Tolles. Thank you for coming on. Will you come on again sometime?
Absolutely.
It wasn't that painful?
It was not.
Okay, good. Break. When we come back, we're going to have Liz Kapitulik, a geriatric case manager, on to talk about what she does. That's going to be fun. Thank you again, Susan, and we're going to take a break.
Nestled amidst the wooded and serene town of Great Barrington, Fairview Commons Skilled Nursing Center is minutes from downtown, in the heart of the beautiful and culturally rich Berkshire County in western Massachusetts. Fairview Commons offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Fairview Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Fairview Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice care, adult day services, and respite care. Fairview Commons offers a state-of-the-art, amenity-rich short-term rehabilitation suite for those primarily recuperating from orthopedic or cardiac surgeries. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Fairview is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident at Fairview Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Fairview Commons, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-528-4560. We look forward to meeting you.
Welcome back to InfoSource. I'm still sitting on my hands so I don't touch my face. And with me now, right now, is Liz Kapitulik. Hello, Liz.
Hi, Jenny.
You have one of the names that I have not butchered on this show. There's very few I butcher Smith.
That's surprising.
And people looked at your name and said, wow, I'm like, it's Kapitulik. I've always known how to say it because I've known you for a while.
That's true.
So Liz Kapitulik, besides having a groovy, cool last name, what do you do?
Well, I'm in private practice. I just want to clear that up. I don't work for Berkshire Health, but I
But a
work,
friend of,
absolutely,
a friend of.
Absolutely. I'm a geriatric clinical social worker, and what that means is I'm your typical clinical social worker that's only worked with older adults and people with chronic medical conditions.
And the reason I asked you to come on the show, and I often have Berkshire folks on because it's a Berkshire show, but I want people to know out in the community that there's support out there that's non-biased, not anything that can help them navigate through the systems. And that's really what your role is, correct?
Yes, absolutely. I don't think people realize that there are case managers, care managers out there to help them. Because it's, well, first of all, you have to pay privately for it. Insurance doesn't cover it, unfortunately.
Right. Okay.
But we're out there and we're willing to help, and we have different backgrounds. So.
And you as a social worker can help with some of that needs, but also navigate doctor's appointments, payments, housing, care issues, because some people don't have the support, or the support they have don't understand everything out there.
Yes, I mean, a lot of people that I help are very well educated and have really good careers and are smart, and they know how to sort of navigate that area. Okay. But this is all I've ever done for work.
And I know, because I knew you way back when.
That's right.
Going back in time, going back. You were a social worker at a skilled nursing facility, and then you became what?
Oh, I was their administrator.
How was that?
Wouldn't recommend it. Temporary insanity, definitely, but
you admire those folks who pursue that career?
Absolutely.
Okay, just not for you.
Not a lot of social workers become nursing home administrators for obvious reasons. So.
Well, all right. But what I've noticed, knowing you then and seeing you do this now, that this is really what you enjoy doing, is helping these folks who need the guidance, the support. Can you just share with us maybe a typical story of someone you've helped, no names, so
Sure.
just hide the identities?
Yes, absolutely. Well, let's see. I mean, I get calls just out of the blue. Either people get my name from an EAP plan, or a lot of people, I think, especially baby boomers, will go on the internet and will Google, and they'll find geriatric care managers, and they'll find me. And I'll usually get most of my calls from family members that are caregivers that are just so overwhelmed, and they're not quite sure what the next step is. And so they're looking for some education, some consultation about what the care needs are of their loved one.
All right. And we're filming out in Berkshire County, and I know you're from Hampshire County. What other areas do you work in? I know you would like to help folks out in Berkshire County as well. So tell me some of the areas you have clients in.
Well, I'm originally from Franklin County.
Shout out to Franklin County.
Right. From Coleraine.
Yeah.
And I live in the hill towns now of Northampton, so I'm all over. And I have clients actually as far as Wilbraham, Westfield, so I'm driving everywhere.
But that's good to help these folks.
Yeah, I like being able to provide the services that are just not happening for people in the system, and we all bump into them every day and are frustrated and saddened and not quite sure who can help us with certain things, and pulling all those pieces together and not being limited by a certain,
And one of the things I was talking to someone about, your role in what you do, and sometimes caregivers and the person going through this are so weighed down by emotion that it's nice to have someone like you there to help them through it, because you do care, but you're not emotionally invested in the situation, and I think that's a hard thing. And you know, when they don't always think that we're saying upfront stuff, because
True.
And that's true, and
Right.
it's the way people are, and especially when they're all emotional. So I can see a third person saying, okay, this, and this would be helpful.
There's no financial incentive for me to go in and say you need this amount of care, or it's really time to move on to skilled nursing or anything. It's just an objective third party who's been doing this work for a long time and has some advice.
And that's, again, I want to thank you for what you're doing. If people want to reach out to you, was Capitulix on the internet?
Yes.
I believe.
Yes, actually, I have quite the social media presence.
And
so
you have quite the
can
flyer. You don't have to
Google
show
me.
it, I just like it.
Yes, and I have a website, eldercarewiz.com.
Okay.
So anybody, just reach out anytime with any questions.
Well, thank you for doing that.
Thank you.
All right. We've cruised through another episode of InfoSource. We did the flu and you, my friend Liz Kapitulik with a groovy, cool last name. Thank you for watching. InfoSource has been a presentation of Berkshire Healthcare System. Till next time, good health, good life. Bye-bye.